Hi, welcome to Wandering with Berto. I'm Berto, and today we're going to hike the Platte River Trail, which follows the Platte River. Around it, you get great views of the bands of the river, from a higher vantage point. This is north of Lake George, Colorado, and it is 6.7 miles long and about 859 feet elevation climb. Most of the inclination is at the beginning, and then also once you hit the end before you turn around, there's a little bit going back up, but for the most part the trail is pretty flat. So what is ADT? So ADT stands for Androgen Deprivation Therapy, and it is a treatment for prostate cancer specifically, where you receive medicine that essentially eliminates the production of testosterone by your body, whether it's your testes or any other adrenal gland or even the cancer cells themselves. Typically, we call this hormone therapy, but for the most part, people just use the short term of just ADT. My medical oncologist prescribed 2 stacks. One is Eligard, which is injection form. So it's a 6 months injection that really eliminates the production of testosterone from your testes. Another medicine you might hear about is Lupron. And then that was stacked with Zytiga, which is in pill form. And I take that every day. And that basically eliminates like the adrenal gland and other cells from producing testosterone as well. My doctor gave me a 2-year treatment plan. And so far I have about 8 months left. So I'm nearing the end of this cycle. And my hope is to not have to go back on it. So I'm going to keep doing what I'm doing, the diet, the exercising, the supplements, to make sure that it doesn't come back and make sure I don't have to do this again. So I'm going to keep going, and I'm going to talk a little bit about each specific drug, and also I'm going to cover the side effects and what I've done to mitigate those. So let's keep going. So what is Eligard? So Eligard is an injection medicine. Like I mentioned before, it's very similar to Lupron. You take it every 6 months. You have to go to the doctor's office, and they usually administer the drug in the same rooms that they use for chemotherapy. The gauge of the injection is pretty thick. So the nurse, first time I got it, warned me about it. It's like, this one's gonna hurt. And it's about the gauge of an IV. So it's not like your typical injection that you would get for like vaccine or something like that. So it does leave a mark. I started with Eligard because the doctors, both the radiation oncologist and the medicine oncologist, decided that it was best to reduce the size of the tumor before I would get radiation. So the first step was to go through ADT, and the first step of ADT was Eligard. One thing that you have to consider is, as you start going into these appointments with oncologists and you start getting treatment, is that the waiting room is going to be full of other cancer patients. And not everybody is going to be in the same boat as you are. So you will see people who are probably in a more progressed stage of cancer. Some of them who are struggling. You'll see people in wheelchairs, pale, which is some color that once you see it, you can't unsee it. And when you see people in that color, you kind of figure, okay, maybe there's a person there fighting cancer. It's something that kind of hurts the psyche a little bit, and it's shocking. And you kind of wonder, is this my norm, right? Like just being here with all these folks and the conditions. So be prepared, because that to me was one of those parts of fighting cancer that was a bit shocking to me. It's just seeing those folks. But now going back to the radiation and the injection, the ADT, is my second shot was given after I was done with my radiation. And my white blood cell counts were low. My platelets count was low, so I was bruising very easily. They gave me the injection, and they usually just put like a little Band-Aid. It's like a circle Band-Aid. You just put it right there on the spot. And I left, and I got downstairs from the doctor's office, and I feel like I'm wet. So I put my hand in there, and I pull out my hand, and it was just full of blood. And I realized I've been bleeding. So I went back upstairs, and they had to apply pressure. And they gave me like a better bandage for it. And then at that point, it coagulated. So, keep that in mind, that if you're doing both and you need to get the, Eligard or even Lupron injection, there's a possibility you will bleed. And the little band-aids that they give you, just don't cut it. So apply a lot of pressure on it after you get the shot to make sure that it just stops any kind of bleeding from happening. So let's keep going. Okay, so the second part of ADT was Zytiga, and it was stacked with prednisone. So the doctor had their pharmacist sent me both medicines via FedEx. I had to sign and everything because they're very expensive. The main rule around the pills, and it's basically 4 pills, and I'm taking 1,000 milligrams of Zytiga, is that you can't eat for 2 hours prior to taking the medicine, and you cannot eat until 1 hour after the medicine. So what I do is I wake up every morning early. I take the medicine, I exercise, shower, and then at that point it's been long enough that I can go ahead and eat breakfast, have my decaf coffee, and start my day. Zytiga is a little bit different than Eligard in that it does target everything else other than just the testes from producing testosterone. So that means your adrenal glands, it means any other kind of glands or cells, including the cancerous cells themselves. Now, what happens is when you're on ADT, after a while, the cancer cells may become castrate resistant, which means that they themselves produce the testosterone for them to feed on. So at that point, traditional ADT no longer works, and Zytiga helps stop the production of testosterone by the cancer cells themselves. Now, it's not 100%, but it does buy you a little bit more time if you happen to be on ADT in a longer term. So, yeah, let's keep going. Okay, so let's talk side effects, because that's really the point of this whole video, is what happens when you do take these medications. And the first one is fatigue. So that you will feel pretty much right away. It will stop you from doing the things that you used to do before. So in my case, I used to hike, normal 7-mile hikes without any problems. And after my first shot, I was down to like 3 miles, and sometimes I had to like stop and turn around and go back. So it really does a lot to your whole energy levels. Drops them dramatic. One thing I do to keep the energy level up, like for example, right now I'm hiking a almost 7-mile hike, and that is exercise, and particularly cardio. So what my integrative oncologist basically said is to do HIIT. So when you do intervals of high impact, high intensity exercise, and then you do intervals of rest, and that has allowed me to extend the amount of distance that I do in my hiking, and I don't feel as tired as I was, when I first started the treatment. So another thing to consider, even after you're like exercising and you have your routine and you're feeling better, is after every injection you will feel tired for about a week or two. So keep that in mind, is that what you typically do, you're not going to be able to do within those 2 weeks after your next shot, for example. So at that point, my activity really goes down dramatically. But it all comes back with cardio and HIIT. You really start feeling better, and you start being able to do the things that you used to do. Not quite at 100%, but in my case, actually even better, because I've been able to do more and have a little bit more stamina than I used to. So definitely what I'm doing is working to counteract the effects of this. Okay, so another side effect is muscle mass loss. So you will lose muscle. And for that, you need to do resistant training. So on top of the cardio and the HIIT, you're gonna wanna do some sort of, free weights or resistant bands, or in my case, I just use the Total Gym. And I do a lot of upper body exercises just to get those going. And then of course for me, my lower body, I'll do squats and then of course hiking. I've seen my muscle kind of decrease quite a bit, particularly during the radiation when I was going through both treatments. But I've been able to kind of regain a lot of that lost muscle, and I'm maintaining it. So you're not going to bulk up in any way, but you're going to maintain that muscle that you have, and that's going to help particularly also with the fatigue. Now, one thing to know, if you go on vacation and you don't get to exercise or do any resistant training, yes, you will lose muscle during that period of time. So you're always working out, just stay ahead of the treatment and the side effects and make sure that you still have some muscles. Well, I know this is important because when I went for a follow-up with my radiation oncologist, his nurse told me that in a lot of cases, patients who have been on ADT for 2 years plus, they lose so much muscle that they can barely stand up from a chair. So I figure that's not going to happen to me. I'm really doing a lot of physical activity just to stay fit and keep that muscle. The next side effect is the loss of bone densities. Now, what I do recommend, and you might want to ask your doctor about it, is to get a baseline bone scan of your body before you go into treatment. Was 10 months into treatment. So to counteract that, I take calcium pills. And in addition to that, all the resistant training helps maintain that bone density as well. Okay, so another side effect is you're gonna gain fat. And particularly in the abdomen, belly area, I do a lot of exercise. So everywhere else, I'm pretty fit, except I have that little donut. I got 8 months to go, and then after that, I'm hoping all this kind of goes away and I start feeling better again. For that, exercise again, keep on top of it. And on top of that, also keep in mind that you're taking prednisone as well. And in prednisone, you swell up a little bit, is what they call moon face, where your face kind of balloons up. So let's keep going. All right, so when you have no testosterone, basically what happens is it induces menopause. So you're going to go through very similar experience than women do when they go through menopause. And one of the biggest side effects that you'll have are hot flashes. Just like women in menopause, you will have hot flashes. Your body is not going to be able to regulate temperature very well, and you're going to feel these heat coming up from the inside out, and you're going to be sweating, and it doesn't matter how cold or hot the room is, you're just going to be really, really hot. So for that, there's not much you can do. But what I've done is I buy full zip hoodies and fleeces so that I can take them off quickly if I'm starting to get one. And I also bought a USB rechargeable portable fan. And I take that, I move it around the house, particularly during the summer when it's really hot. And I just get that ventilation and that breeze, and that cools me off a little bit. So consider getting one of those, and also consider full zip clothing. Now, since you can't regulate temperature well, another thing that will happen is you're going to be really cold. And for me, it was really, really bad around the time that I was doing radiation as well, and pretty much like for quite a few months after radiation, I just felt cold. I would wear a blanket on top of me, and it could be like 78, 80 degrees outside, everybody hot, and I'm just like freezing. So another menopause related side effect is brain fog. You're going to be confused. You're not going to be as sharp as you used to. You're going to forget a lot of things. Sometimes you might not even be in the moment. So I found that to help with this, I write everything down. So at work, I have my laptop open and I have my notes application right next to it. Every time anything is said, I add it to that just to make sure I can remember, because I will forget. Another one is body hair loss. Not necessarily in the head. Actually, the hair in the head is actually doing much better. I actually do have quite a bit, even though I have hat hair right now. But everywhere else in your body, it's thin out quite a bit. So my legs are kind of patchy and almost no hair. My chest is pretty clear except for maybe a little patch of gray up here. My arms have barely any hair. So all your body hair is going to go away. And that, if you don't like body hair, maybe that's a positive. For me, it's a little weird. Okay, another one is you can't grow breast while you're on ADT. Now, me personally, I haven't seen any difference. I do a lot of chest exercises in the Total Gym. I don't see a difference, but I do know, going on Reddit and some of the other bulletin boards, that it does affect a lot of people. In some cases, to the point where you have to wear like a sport bra or something like that. I don't know. I still have 8 months to go. So I don't know as I get farther along if it's going to happen. If it does, then I will let you all know. Let's keep going. Yep, my mic stopped working. Well, these are the things that happen when you're recording basically in the middle of nowhere. So the hike was a long one. It was a bit over 7 miles as I clocked it, a little bit higher than what AllTrails said it was. And I actually prefer a little bit shorter hikes with a more elevation gain. And to me, the payout of actually reaching a summit is better than, a more flat, long hike like this one. Now, this was a pretty hike. It had the river and it had a lot of scenic views, and then it ended at the riverbank itself, which was kind of neat. But it's not the best hike that you can do. But if you want to do it, go ahead, but just keep in mind that it is very long. So finishing up the conversation about side effects of ADT. And one thing to consider is that ADT will impact your glucose as well as your blood pressure. In my case, I had brought down my A1C to 5.4. But as I continued ADT treatment, my A1C shot up to 6.2, which is still pre-diabetic. It's not totally bad, but it is something to consider that you may experience a spike in your sugar levels, and you might want to adjust your diet a little bit. And in some cases, if you happen to be like diabetic or anything like that, you might end up upping your medicine to address it. The other part was blood pressure, and my blood pressure went really high. I had been able to wean myself off of all blood pressure medication through diet. I just didn't need it. And after a while on ADT, all of a sudden, I once again needed that medication. So I'm back on losartan, and that brought it down to the levels that I need. And so I am right now at normal levels in terms of blood pressure. Another thing I did notice, and I researched this, and this is part of ADT, is that my potassium levels went way low. And for that reason, what I did is I incorporated half a banana in my morning green juice just to raise my potassium. And then, of course, I not fully eliminated, but I reduced the amount of salt that I take every day. Now, the last side effect, I left it to the very end because I really didn't want to talk about this one, and that is sexual dysfunction. I remember early on, my urologist sat down with me and started telling me all about this was going to happen. It seems to be one of those side effects that's related to not just ADT, but a number of different treatments for prostate cancer. And he gave me a list of all sorts of remedies to address this. And some of those I wouldn't consider, things like implants and things like that. I was like, no, I'm not doing that. And for the most part, I dismissed that whole conversation. I figured, well, is it really going to happen to me, right? So in a way, it did. So what I found over time is that two things happen. One is the ED part of things. That is true. It will happen. And then the other part is that you lose your libido dramatically. You really have no sexual desire left. Now, to combat this, I read on Reddit that some people were taking daily dose of Cialis, and that has worked for some people. Now, it does work part of the time, but not all the time. And it doesn't work as well as otherwise Cialis would work. So in that situation, I'm considering one of the treatment options, which are injections, and it's called ICI. And as much as I cringe to the thought of injecting, I think it might be something I will definitely consider in the future, and hopefully it will work. I have 8 months left on this treatment, so it's going to be a short-term thing. And my hopes is not to go back on ADT again, and that everything is clear for a long time, so I don't have to deal with these side effects ever again. So in my next video, I'm going to be talking about radiation. I had two types of radiation. I had SBRT to the spine, and then I had general radiation to the prostate area and surrounding tissue and lymph nodes. And I will talk about my experience with it, particularly the fatigue and some of the side effects that happen during both types of radiation, and how I coped with some of those side effects, which, by the way, you'll feel them months after radiation was completed. So it's not just something that happens during, it will just keep affecting you for a little bit. winter is almost here and hiking is going to be a little more difficult. So these are going to be more rare. Rather than weekly, it'll be probably once every few weeks. And that's because the trails, some of them are closing, some of them are going to be too icy to hike, but I will still try to go out there on the trail and still try to record these. So really stay tuned, subscribe. And if you like this video, also click like. It helps me get my message across and hopefully help those who have started their journey. Thank you for watching this video, and peace and love on your journey.